Thank you, our dear friends, the residents of Nyandarua, and our people from Nyandarua who work and also reside outside the Nyandarua County. I'm Dr. John Mungai. I'm the CEC for Health. The Kiswahili name for CEC is Waziri, so ni Waziri wa Afya Nyandarua. And today, I take this opportunity to be able to interact with you. I have some questions that have been raised concerning our health in Nyandarua. I'll be able to address it. So today, what do we do? What is our vision? What is our mission as a Department of Health in Nyandarua? What we do is to make sure that the healthcare in Nyandarua is up to international standard. And in doing so, we set out to make sure that the health is accessible, meaning that everyone in Nyandarua can walk within 5 kilometers and get a health facility, a dispensary or a health center or a major facility. And also we make sure that the essential treatment is available. That is in summary. There are many other things we do, and some of our strategic objectives is to make sure that we prevent diseases. Now, preventing a disease or an illness is a very, very broad mandate. It includes making sure our roads are clean, our towns are clean, making sure our children are immunized, making sure our mothers, when they are having the children, when they are pregnant, they come to our clinics, they are attended well. Preventing diseases means also that we ensure, together with the water department, that our water is clean. So we do our best to make sure we prevent diseases, but diseases do occur. So when they occur, our other major strategic objectives is to make sure we have treated to international standards. And sometimes a person will be treated, they get well, and they don't need a follow-up. The others, for example, if you have an accident, you are treated, maybe you put a plaster, you get well, but you also need physiotherapy. We call that rehabilitation. So we treat and rehabilitate to make sure that the health of our people is top. Now, that said, before I come to answer the questions, allow me, because of the COVID-19, just touch a little and remind our people in Nyandarua that COVID-19 is back in full swing. Like the rest of the country, Nyandarua County is also being affected. We have seen cases are rising. In fact, they have risen from around 58. Now they are 194. So we are asking our people to double the efforts of prevention. Please make sure you put a face mask and make sure it covers your nose and your mouth. Of great importance, avoid meetings, avoid gatherings. If you must attend, make sure you are 2 to 3 large footsteps away from each person, and wash your hands with soap and water. If you have no soap and water, there's sanitizer like this one. You make sure you sanitize well. It's very important because so far COVID-19 has no cure. We know in Nyandarua, in the first wave, we were able to minimize people infected in Nyandarua. Even this wave, we are trying our best. We are asking our people in Nyandarua, every one of us, led by His Excellency the Governor Francis Kimemia, to the common mwananchi, let us make individual efforts to prevent the spread of COVID-19 in Nyandarua. As healthcare workers, we are ready in case one gets infected. We are ready to care for them. That said, I can see here Karungu David. Karungu David from Machinery, Githima. You are saying that that area of Machinery, that's in Kipiperi, Machinery, Githima, Mahindo, and the surrounding areas, they have no single public facility. And yes, that's a very good concern. Although we are doing well in having everyone, almost everyone, access a health facility within 5-kilometer radius, there are areas in Nyandarua that have not achieved that. And that area of Githima, Machinari, and Kipeperi is one area. We know the nearest health facility we have Ledeshua and we have Turasha. But you know, in Nyandarua we have valleys. We have valleys and mountains. So sometimes the facility may be 5 kilometers away, but a big valley is there, so accessibility is a problem. So we are looking into that area, among other areas. We have a BOD Zero track that goes there at Kafati, even as we make sure that in the future, I've noted that concern. We are going to look into that area. The other areas that also not well accessed, like Orumagogo in Murungaro, is being looked into. The other areas, like Gamini in Daragwa, is being looked into. The other is like Kahiga in Gadaji Ward, and some others. The government of His Excellency, the Governor Francis Kimemia, has done very well. Since 2017, we have been able to put 15 new health facilities. A lot of them are complete and they are open. I'm happy to say that Monoru people, they call it Rereshua with the R, are now enjoying a new health facility, dispensary, working this year. People of Charagita, in Charagita Ward, they're enjoying a new health facility. People of Kimathi in Kipeperi, they used to walk very far, they're enjoying. People of Geshungo in Kaibaga, they're enjoying. People of Kanguo, we have just opened the gates of Kanguo in Gatumo Ward. Gatumo Ward used only to have Gatumo the center. Our ward, now they have another one called Kanguo. So there are many others that are being opened. Oraimutia in Charagita, I have not forgotten you. Kehuha in Shamata, we have not forgotten you. Karamton, Uko, Reshapodo, side of Daragwa sub-county, container clinic is coming up. Those people far away to us in Nakuru, Makara area, in Merangino Ward, we have a container clinic that's almost getting opened. Kadrega Ward, in Gedioro, your dispensary is almost complete. And many others. So we are going to address that area of Machinari area together with the other areas. Thank you, Karungu, for raising that very important issue. I can say Mase Wanja, you have raised a very important issue of the job applications. You said you applied for a job in health. When are the recruitments? Are they going to be fair? That question is best answered by the County Public Service Board. But you are one government. I can tell you there is a lot of diligence in recruitment in health. So be patient. I'm sure they will communicate with you. And many other applicants have seen that these issues. So that is the reply, and I wish you best success. There are issues that have been raised of recently recruited health workers who have not been paid, community health assistants. I can see someone has asked, when are these? That's Lois Kahea. When will the innocent community health workers, when will they be paid? Yes, their payment has been delayed a bit. We have been communicated with together with the County Public Service Board and the Minister of Health, National, and they have promised they are looking into that issue. There are few of them who have not been paid. The issues are being addressed. And at this point, let me talk about the welfare of healthcare workers in Nyandarua, especially in this COVID era. One of the issues that we have worked very hard with His Excellency, the Governor Francis Kimemia, is to make sure that our health workers' welfare is looked into, especially promotions. There was a big delay in promotions for various reasons, but now I can happily say, and our health workers can confirm, including the unions, that there have been massive promotions. About 400 people applied for promotions. Almost 300 have now received promotions. And the others who have not received the promotion letters, the process is ongoing. So it's very important. And one of the issues that has been raised by various people is why you be building so many health centers and not recruiting workers. There's a standard of how many health centers should be there. Within Nyandarua or anyone in the world, the standard is within 5 kilometers, you should be able to walk on either side. When you are unwell, you can walk within 5 kilometers and get a health facility. We are almost achieving that in Nyandarua. Now, what His Excellency the Governor, Francis Kimenya, found in 2017 when he came in, is that many facilities, especially dispensaries, had one nurse. And whenever either she went for leave, annual leave, or she went for official meetings, or she went for training, the facility would have to be closed. Now, what we have done is to recruit health workers. We have already recruited and deployed 311 health workers of various types, nurses, clinical officers, doctors, laboratory people, 311. And therefore, we have been able to ensure that at least every dispensary has 2 health workers, and therefore it cannot be closed during working days. Health centers, there were facilities that are health centers, like Idemi, they were not able to work 24 hours. So now we have been able to post people, health workers, to make sure that it is able to work for 24 hours. Karagada is a beneficiary, among others. Big facilities like JM here in Olkalau and Engineer in Kinangop have also benefited. So we are able to give more services. So 311 have already been employed. Currently, as we have seen in the papers, there's recruitment of 76 more. And because of the COVID-19 and universal health coverage, we are expecting another 70 more from the national government. So we expect another 146. That will be almost increase our health workers numbers by 50%. So that's very important. All your health facilities are well covered. I can see a question, a very important question, before I finish with this issue of health facilities, about Mwakaine Dispensary. Mwakaine Dispensary is in Sibara area of Shamata Ward, and the question is from Peter Muchemi. And Peter Muchemi is worried. Why is that dispensary being close to others? No, it's not close. From you are at Sibara town, the nearest is Shamata Health Center, and then the other one is Subuku Health Center, and they're very far. So that dispensary, Mwakaine, is almost complete. It was started last year by His Excellency the Governor, and it's almost complete. It's going to serve the people of that Sibara area very well. Also, down there, towards Borosa, toward the lake, we have Kirima, the dispensary is functioning well. I know there's another dispensary called Kangofiri. It's in Daragwa Central, but also towards the lake there. It is the construction is ongoing. So that area of Shamata and the upper Daragwa Central is well covered. So our residents, our dear people in Nyandarua, you are going to benefit from the efforts of His Excellency the Governor Francis Kimenya in terms of health facilities and in terms of care. And another question that has been raised is on the issue of these facilities. Yes, they are there. You have put the health workers. Yes, they are there. And when are you giving us enough drugs? That is a concern, a very genuine concern that keeps being raised now and then. And it's very genuine. We are happy when we receive the feedback from the public. Nyandarua is doing very well in supply of drugs. We are able to fill 90% of the prescriptions. Now, I know in the last 3 or 4 months, we have had problems with the supply of drugs for high blood pressure and diabetes. Now, the problem has not been money. The problem has been our supplier by law has been KEMSA, and KEMSA nationally was not able to supply those drugs. So that issue, you know, in the last 3 weeks, there was a court case where the county governments, they went to court and they won, so that KEMSA can allow other suppliers to give us drugs. So now that we have opportunity to source drugs from other companies, other suppliers, we expect that problem to go away. So we are going to supply with the drugs for diabetes, for hypertension, in our dispensaries, in our centers. Now, what I would like to ask our people is this. Especially for the care of diabetes and high blood pressure, it's not just the drugs. We want you, even as you get drugs from our dispensaries, every 3 months, or at least once in 6 months, you go to a health center where the clinical officer or the doctor will check, make sure your eyes are functioning well, making sure your kidneys are functioning well. He will look at your foot to make sure you don't have wounds. He will examine you and check your heart, so that even as we control your blood sugar, as we control your blood pressure, your major organs, the eyes, the heart, the kidneys, they are functioning well. So we'll be asking you, you have taken drugs for 3 months, yes. So now next month, visit your nearest health center, be examined and come back. That said, nowadays we are trying, it's now recommended that even dispensaries, we have a clinical officer. So we are sending even the clinical officers to the dispensaries. Those that don't have clinical officers, we have a program of training our nurses that started last year on care for diabetes and care for high blood pressure. So don't be worried. The staff in our dispensaries, in our centers are well trained to take care of your diseases in Nyandarua. Now, our viewers, allow me to comment on something that is very important in the care of COVID people, COVID patients. Currently, at least by yesterday, we had 194 positive cases. How are we taking care of them? The main way of taking care of them is what we call home-based isolation care. Because most of the patients who have COVID-19 are aware. You know, you are tested, you are told you are positive, but you're not feeling anything. So our team, they talk to you, they assess you, there's a form, they tick, they ask you, how is your home? Do you have a toilet? Do you have where you can wash hands? If you meet that criteria, you are told what all we want you to do is stay at home. This is the number you call in case of problems. So most of our people are on home-based care. There are a few, who need to come to our isolation centers. We have several isolation centers. We have one at JM, it's just here, next to me, next to ICU there. We have one at Engineer. We have a major one at Babu. We have another major one at Gano. Gano is in Orojorok sub-county. That in case we need extra, we have another one at ATC Orojorok in case we need extra. Now, those isolation facilities are ready for use in case they are needed. But we are hoping that most of our people will be taken care of at home. We have bought isolation beds. 300 new ones are there. If we ever need more than 300, we have another 195 on standby. We hope we will not need them. We have a county COVID-19 case management team led by senior doctors in Nyandarua who are able to respond to your needs in case you need. We have 2 ambulances on standby. One that is based at Iginia, it will serve the former Nyandarua South, that's Kipipiri at the Kinangop sub-county. Another one based here at JM is serving the former Nyandarua North, as Olkarau, sub-county Rojorok and Daragwa. And they are doing very, very, very well. Now, there are a few patients, maybe 1 or 2 at any time, that may need very intensive care, what we call high dependence unit care or ICU care. We have an ICU. It's just next to me here. It's well set with equipment. We have a team of 30 healthcare workers, from doctors to lab people to ICU nurses, that are ready to serve you. Our prayer is that nobody gets too sick to go to ICU. We don't want anyone to get too sick, but just in case one needs ICU care, our team is ready. And of course, His Excellency the Governor is recruiting to the County Public Service Board. It's currently ongoing recruitment of additional medical specialists, ICU nurses, doctors, even anesthetists. Those are the doctors who are able to put tubes for you to breathe. This will boost our case management team that's taking care of the very sick patients. I know there have been some questions, like, do you have enough oxygen in Nyandarua? Of course we have. The hospitals, health facilities in Nyandarua have always been running well. We have always had enough oxygen supply. We have boosted, because of COVID-19, we have boosted our oxygen supply. So we have not had problem with the oxygen supply in Nyandarua. It is there for those who need it. Of course, it is a drug like any other drug. We take care of them, of those drugs, including oxygen, and we don't waste. But it's there in adequate supply as required. As I conclude, allow me to thank you, our dear resident of Nyandarua, for the trust you have had with our health department. Despite the few challenges, you have trusted our health facilities. The people who have come to seek the health service in Nyandarua during this COVID period, the numbers are equal to those who came before the COVID, meaning that you have trust in us. Trust your doctors. They are doing well. They are well covered. I can see a question here that is asking, why don't we give our health workers enough PPEs, like coveralls? Yes, be assured that in Nyandarua, our health workers have all the required PPEs. They are very well trained in infection prevention and control. We have a team of specialists that train our people. We have partners that come in from time to time to train our people. We even assessed, and we score B+ and above in infection control in Nyandarua. Our health workers safe from COVID-19. Yes, they are safe like every other healthcare worker. But COVID-19 is a very tricky virus. Even as we use the PPEs, yes, some of our health workers are getting affected. Now be a pole, and we are giving the maximum cooperation and care, and making sure that every opening that may be there in supply of PPEs, infection control, is closed. So our healthcare workers, we are with you as a county government of Nyandarua, led by our Governor Francis Kimemia. We support you. Your allowances, your salaries, your PPEs, your promotions are well taken care of. Thank you. Asante sana msikilizaji wetu wa Nyandarua. I'm Daktari John Mungai, Waziri wa Afya.